anemia and this is
Don't name friends, no hepatomegaly. Yes,
the liver is 2 centimeters.
and fluid in all spaces.
This lady has
Every shona jaচ্ছে তো এমনি
this lady has presented with Anasarca, breathing difficulty, and on examination we found that she is severely anemic and for the urine, and blood pressure is also raised. So there is a possibility of a nephrotic syndrome in the picture, and because proteinuria could be there. There may be proteinuria, and the blood pressure is also high. That may be due to some underlying renal problem, and she is also very anemic. And the other findings are the Anasarca and the other findings.
all could be explained by the.
Could be due to this. So what I think is the major brunt of the disease is mainly in the kidneys, and then secondary involvement of other organs.
So we have two opinions. One opinion is primarily a cardiac problem, another is primarily a renal problem. Any other opinion?
Is it anemia? Why anemia? Dystrophic nails. Was it koilonychia? That is,
I don't know.
No, sir.
Anemia could be explained by
kidney failure.
Okay, fine.
Sir,
I think what Dr. Paul has stated, I also agree on that point. The patient was otherwise well, more or less stable, but at least the last 2 months he has developed all these problems related to some suggestions pointed to renal pathology. Of course, nephrotic syndrome, I think the distributional edema, the facial edema, I think that was lacking for us in this case. So when we come from the Anasarca with nephrotic type of or nephritic type of presentation, we expect some sort of. So I think this is just not explainable by only renal. And elderly lady will have many multiple pathologies. That's number one, because that's a geriatric principle. You will not have to explain the whole thing by just one disease. The patient is hypertensive, hypothyroid. I think whether it's an uncontrolled hypothyroid, whether a thyroid status is normal, that also is to be taken into consideration. Number one. Number two, I will more be in favor of a nephrotic type, other than nephrotic. So I think there will be some nephrotic, and maybe some glomerular vascular syndrome. If you look at the Harrison's textbook, they have given the classification of nephritic syndrome in 5 or 6 categories, where there is a comment of glomerular vascular syndromes, and ALRD, maybe anything atherosclerotic also, renal involvement may be there. Whether there is associated any other vasculitic problem, I don't know, because it is done any other symptoms or signs related to vasculitis, other areas. So it could be atherosclerotic renal arteries problems in the background of ALRD hypertension. Now, whether the patient has got primary cardiac disease, because as Dr. Our chairperson was telling, which one was bigger, which one was earlier, whether it was edema or discomfort of the chest. Now, usually, congestive cardiac failure does not give rise to dyspnea, usually, because there is less renal pulmonary involvement. So, it may be a biventricular or biventricular failure. In that situation, one can explain this. I was also thinking of any lung pathology in the form of elderly. Many times you have got some interstitial ILD associated. I don't know, although there are no clinical case of these things. Maybe this may be related to the pleural effusion. This dyspnea may be related to it. So polysinusitis. The differential diagnosis of polysinusitis, there are so many conditions like tuberculosis, of course there are no infections, then SLE, all these things. So maybe I don't know whether these will fall into those categories. So I think there are a lot of things to be considered in this index patient. But I will be more in favor of a nephritic type of presentation, hypertension, edema, brothy, urine, etc. in the background of hypertension and hypothyroidism.
Thank you.
Thank you.
Thank you, respected teachers, for your opinion. So, as we have We are anticipating a nephrotic syndrome because patient has, as everybody has said, Anasarca with fibrillation and newly diagnosed hypertension. Nephrotic syndrome can also be a possibility. However, there was no history of hematuria in this case.